At the UBS Optimus Foundation, we help clients address the world's most pressing social problems. Whatever clients want from their philanthropy, our offering spans the spectrum, from groundbreaking development financing tools to high-performance, data-driven programs that deliver large-scale transformational and sustainable change. How do we do this? Let's look at one inspiring example: Last Mile Health in Liberia.
When I first came back to Liberia in 2005, the first newborn that I cared for was a 7-day-old with pneumonia whose mother didn't receive any prenatal care because she lived 8 hours from the nearest clinic in the middle of the forest. And those kinds of experiences made us realize that illness is universal and access to care is not.
The UBS Optimus Foundation is trying to bring more and better money to solve social challenges. And we're doing that in a way that helps our clients achieve real social impact. We're trying to bring a more analytical approach to an issue where people generally only bring their passion. What might seem like the most obvious solution often isn't. And that's why Last Mile Health is so successful. They have completely changed the model of how healthcare is delivered in some of the most remote places.
Community health workers are recruited from their own communities. They're then given the training, the medicines, the coaching, and the jobs to provide healthcare and bring it to the doorsteps of their neighbors. They use smartphones to help us track the data.
None of the other partners are using mobile health to collect data, to also provide additional information to the CHWs. The device, the community health workers is able to make reference from time to time and have guidance in how to treat and even how to go out and do health education.
Community health workers are people who are trusted in their communities and people who speak the local dialect, people they've known all their lives.
The challenges are very huge working in last mile communities, but we've been fortunate to have foundations who are willing to support the work we do.
Our first grant to Last Mile Health showed that Last Mile Health could train a community health worker for a cost of $3,000, which would reduce mortality rates by almost 56%. And I would say that's a great investment.
But UBS Optimus Foundation has always been strategic in understanding that if you continue to put support in strategic catalytic ways, even storms like Ebola will not weather your investment.
UBS came to our rescue, provided some funding that helped us to respond to the epidemic.
We launched a fundraising campaign at UBS, and we were able to raise more than 2 million Swiss francs. Last Mile Health not only helped to contain Ebola in the districts in which it was working, but they were also able to continue to deliver some essential medical care.
It was partners led by UBS Optimus Foundation that helped us respond, that helped Liberia's community health workers, frankly, rise up. They used smartphones that actually UBS Optimus Foundation had initially invested in to help us track the data and help literally break the chain of transmission. I mean, they help hunt down this virus and stop it in its tracks. And what we learned from that experience is that no condition is permanent. Even in the most hopeless of conditions, it is possible for humankind to respond. The UBS Optimus Foundation is extremely focused on data, and that data was critical for inspiring the Ministry of Health to create a national program that would bring a health worker within reach of every child and every family in our country.
We were able to help provide the evidence base that was essential for the government of Liberia to truly understand how this program was working. Last Mile Health is truly a success story. Treatment in some of the leading killers of children has gone up by 30 to 60%.
A global army of community health workers, it saved 30 million lives by 2030, and that's not just an abstract blueprint. You have to have the rigor that an investor has. And that spirit of going wherever it takes is what really epitomizes the partnership between UBS Optimus Foundation and Last Mile Health.
So if you go into the last mile to deliver services there, it means you care, really, yeah.